When most people think about high blood pressure, they think about salt. Too much salt, processed food, takeaways. And if you're someone who cooks at home, avoids ready meals, walks regularly, and genuinely tries to look after yourself, you assume you've already dealt with the problem. You've done what you've been told. But here's the part that often confuses people. I had a patient sat in front of me in clinic. Their blood pressure is 162/96, not once, but repeatedly. I ask about their diet, it's clean. I ask about whether they drink alcohol. They don't. Not a smoker. They exercise. They're not significantly overweight. And you can see the confusion on their face because they did everything right. And yet that number, blood pressure, hasn't changed. It's always remained high. That's not laziness. That's not a lack of discipline. And it's certainly not a moral failing. Something else is going on. What many people don't realize is that while they're focusing on salt and exercise, there is another system in the body quietly working in the background. A hormonal system, which is active all day, and it can influence blood pressure much more than people realize. The central hormone here isn't salt, it's insulin. Now, most people know that insulin as a hormone is linked to diabetes, but insulin does far more than control blood sugar. It also sends signals around the body, and one of those signals goes to your kidneys. And that signal tells the kidneys to hold on to more sodium. And when sodium is held in the body, water will follow. And when water increases, your blood pressure starts to rise. Assalamu alaikum, my name is Dr. Azad. I'm a medical doctor and a pharmacist based here in the UK. And after 15 years in clinical practice, I see the same pattern again and again. People who look healthy, people who are trying, but those internal systems are slightly out of balance, and that causes issues. And the difficult part is that they often feel completely fine. High blood pressure is called the silent condition for a reason. Most people do not feel anything developing in the background. So let's slow this down for a moment. The traditional explanation for blood pressure is simple. More salt, more water retention, higher pressure, and sometimes that explanation is correct, and that's all that people need to know. But when someone has already reduced their salt intake, something else is driving the problem, and very often that driver is insulin. Insulin is meant to rise and fall throughout the day. You eat, insulin rises. It helps move nutrients into your cells, then it falls again. And that rise and fall is very important because insulin doesn't just control glucose, it also affects the kidneys, the nervous system, and blood vessels. When insulin rises briefly after a meal, that's completely normal, but problems begin when insulin stays elevated most of the day. And modern life makes this process surprisingly very easy. Breakfast, a snack mid-morning, lunch, coffee with milk, an afternoon snack, then dinner, then something small before bed. Even if the food is healthy, you're still triggering insulin again and again and again. So the hormone never really returns to its baseline level. It just stays slightly elevated all day. And when insulin stays elevated, the kidneys receive a constant signal. Let's hold on to more sodium. At the same time, the nervous system becomes slightly more activated and the blood vessels become a little less relaxed. Each effect on its own is small. You won't feel it. There's no pain and there's no warning signs. But over months and years, the body slowly resets to a higher pressure. So when the diagnosis eventually appears, it feels sudden. But physiologically, it has often been developing quietly for a long time, for years. So let's talk about the kidneys for a moment, because this is where the mechanism becomes a lot clearer. Your kidneys filter your blood all day, and they constantly decide how much sodium and water to keep and how much to release in urine. Hormones guide these decisions. Insulin is one of those crucial hormones. When insulin levels stay elevated, the kidneys are more likely to retain sodium, and that is useful in short bursts. Our bodies adjust with the environment where food sometimes isn't available. This temporary sodium retention helps survival, but the system was designed for short pulses, not constant stimulation. When insulin stays elevated all day, sodium retention begins the default setting and blood pressure slowly creeps up. Now, here's another important point. Appearance can be misleading. We often assume that if someone is slim and exercises regularly, their metabolism must be perfect, and that isn't always true. You can be lean on the outside and still have metabolic stress internally. Fat around the liver can interfere with insulin signaling, and when this happens, the body produces more insulin to keep blood sugar normal. So blood sugar may look normal, but insulin levels are higher than they should be, and that combination can quietly push blood pressure up. This situation is actually quite common, especially in today's world. It can happen during menopause, it can happen with poor sleep, it can happen with chronic stress, even moderate alcohol intake over many years can contribute for you to be in this state. People often feel frustrated when they hear this because they are already doing the right things, and that frustration is understandable. But the key issue is often not just what we eat, it's how often we eat. Frequent eating keeps insulin elevated. Grazing throughout the day, having a snack here, having a snack there, just snacking constantly will disrupt that. Drinking calories in coffee or smoothies, late night eating. None of these behaviors are automatically bad, but together they extend the amount of time insulin stays elevated. And when insulin remains elevated for most of the day, the body never fully resets. So when does your body get a break? Now here's the most hopeful part. This system is reversible. You don't need extreme diets. You don't need to punish yourselves. What the body often needs is simply space. Periods where insulin is allowed to fall back to baseline. When insulin drops, the kidneys release sodium, the nervous system relaxes, and blood vessels regain their flexibility. So your body recalibrates during this period. Exercise is very important. That will improve insulin sensitivity. Good sleep restores hormonal rhythm, even when small improvements can shift your baseline over time. Now, of course, if you already have high blood pressure, this doesn't replace medical care because medication may still be necessary. But if you've been trying to manage your blood pressure and feel confused about the numbers, it may be worth thinking about the bigger picture, not just about what you eat, but how often your body is being asked to release this hormone, insulin. Sometimes the solution isn't another restriction, it's simply allowing the system time to rest. Allow insulin to fall, allow the kidneys to release sodium, and allow the body to reset. We're not just lowering the number on a blood pressure monitor, we're protecting the heart, we're protecting the brain, and supporting long-term metabolic health. Thank you for staying with me to the end. And if this helped you see this topic differently, feel free to subscribe so you don't miss the next one. Take care. Assalamu alaikum.